Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café. And today I have with me Dr. Anshul Gupta. He's a board-certified family medicine physician with advanced certification in functional medicine, peptide therapy, and also fellowship trained in integrative medicine. He has worked at the prestigious Cleveland Clinic Department of Functional Medicine as staff physician alongside with Dr. Mark Hyman. And currently you specialize in Hashimoto's disease. And so many people are misdiagnosed. If they're diagnosed, they don't know what to do. I'm so happy. You also have a book coming out on this, or it is already out, right? Your book?
It is already out, yeah.
Yeah, no, so we definitely will put a link so that people can learn more about this. But before we really start, I want to welcome you and also ask you, how did you get interested in your own path, as a physician, as what brought you there?
First of all, thank you so much, Dr. M, for inviting me to the show. You guys are doing an amazing job of educating a lot of folks. So I'm really privileged to be here.
Oh, thank you.
Now let's talk about my story. So, as a functional medicine physician, we all kind of have our own health struggles that we go through that lead us to this path of functional medicine. So my actually thing started off, after completing my family medicine residency. I was working in a very busy primary care job. And after doing that for a couple of years, I actually started having some of the health issues of my own. I was having this horrible, horrible stomach pain. And nobody knew what was causing the pain. The pain was so severe that it will frequently cause me to double over.
Wow.
Sometimes I even thought about going to the emergency room to get help for the stomach pain. But I knew that they could not do anything except for giving me pain medications because they also didn't knew that what was going on with me. I was also getting very, very tired. Like during the day, I had to take a nap just to go through a work day, which was like kind of very, very challenging for me. I was also feeling a little bit brain foggy that, I was feeling that, my mental capacity or clarity was not exactly the same as it used to be. And I started gaining weight, even though I did not change my diet, which was
Right.
all different things for me. So I thought, well, I'm a good physician. Let me treat myself. So started taking some medications. They did not work. I was same miserable person. I added more medications to see if they will be helpful. But again, no changes. My actually symptoms were getting worse. So I thought maybe I'm not a smart physician. Let me actually get help with all these different specialists who can maybe treat me. Went to specialist after specialist, gastroenterologist, allergy specialist, did tons of testing, endoscopies, ultrasounds, blood work. Everything was normal. The specialist was all like, we don't know what is wrong with you. Maybe we just need to add more medications. They added even more medications. And none of those things were working. I was not getting better. My health was going downhill. This pain was getting worse and worse, and it was random. It will just hit me at random times, and I was just not prepared for it. I was just 32 years of age at the time, so I was really scared. I didn't knew what to do with my health. I was helpless and hopeless to
Yeah.
kind of, I don't know what to do. At that time, somebody actually introduced me to functional medicine. They told me that, well, people who don't get help with conventional medicine, these are like all weirdo people go to these functional medicine doctors. I was like, really? I'm a weirdo now? But I said, well, I guess, like if they can help me, why not? So I started training my functional medicine, and then after my training, I actually started developing my own protocol for myself. First of all, I figured out what was my root cause of my problem. And then through a series of steps of changing my diet, changing my lifestyle, taking some right supplements, within 1 month, my pain was gone. Within 6 months, I was off all medications. The pain was completely gone. I lost 40 pounds during that time. I had more energy in my life than ever had. My energy was so good that finally I was able to complete a 5K rugged maniac which I could not think about doing it, like any time in my life.
Wow.
So at that time, I realized the power of functional medicine. And then I realized that, okay, there are so many people like me, who have lost hope or nobody can help them out. So I need to share this with all of those people. And that's where I jumped into the functional medicine side. And that's what I've been doing for several years now.
Well, I love hearing stories like that, because it's true. The worst thing is to lose hope. And and we're brought up believing that these doctors, and you are a doctor, but it doesn't mean you are God. You have all solutions. It's a type of training, right? And sometimes we need other ways of looking at the body and at health altogether. So I was just curious, when you went, it looks like you ended up going at first in your journey for different specialists. So you had the gastroenterologist, then which are all the separate body parts. This is that a bit how it was looked at, right? Like, it is a problem with this part or this part. Is that your experience of?
That is correct. Yeah, it is a very fragmented care or fragmented way of looking at things. We have divided a body into different body parts, and we feel that they all just work separately, not in tandem. But through functional medicine, what I realized was that, each and every body part is connected with each other. We are
Right.
complete as a whole, not just kind of, one body part or anything. I call our body as a symphony, that, like each and every instrument is a body part. But if one instrument is not working, the whole symphony doesn't sound good. So that's the reason, like it is very important for each and every body part to work together with each other to actually make us feel better.
Yeah, it's funny when you say symphony. In my TEDx talk this year, I said exactly that. The body is like a symphony.
Awesome.
But
Wow.
it really is like that, right? And we need all the instruments. They work together. There's a rhythm, there's a beauty in how it works together, that when you use the Cartesian separate model of every single thing is separate, it doesn't really work, right? It doesn't make sense like that. So, well, let's dive into, well, what would you like to cover first? I think you're the one with the knowledge on this subject. What would help people the most? What do they like? I think your story is great, because you might not think, oh, thyroid, oh, it starts with a stomach problem. Maybe there's an absorption issue, or maybe there's people don't usually think that way. So what would you like to share on that subject, that to make it easier, that people think, oh my, maybe I have to look somewhere a little bit differently?
Right. So actually, I want to start off with kind of having a little bit of understanding for the people about like how, like, the thyroid disorders are misunderstood. So typically, the conventional medicine feels that the thyroid disorder and Hashimoto's are exactly the same, or what we call as hypothyroidism. They feel that the problem is that the thyroid gland is not able to produce enough thyroid hormone, and that's the reason people are feeling the way they are. But new research studies suggest that even supplementing people with thyroid hormone, they still feel miserable. Their symptoms do not get better. So there is more to this thyroid disorder than just the deficiency of thyroid hormone. So in Hashimoto's, what happens is that it's an autoimmune disease where the thyroid gland actually is being destroyed by these antibodies which are being produced by the body. So the underlying problem is this inflammation, this autoimmunity. The underlying problem is not a deficiency of thyroid hormone. So it doesn't matter how much, like thyroid hormone we supplement, we're not taking care of the actual problem. And that's the reason people do not feel better. Now, the next question which happens is that why do people develop autoimmune diseases? And then, like, is it suddenly one day? Why does our body decide that, okay, well, I'm going to produce antibodies and destroy myself, like on my
Right.
own? So then what happens is that, there are certain triggers, which are present in our environment. So now what we know is that Hashimoto's disease is an interplay between your genetic makeup and the environment around you. So, well, we cannot change the genetic makeup, but the environment around is a trigger which causes people to develop Hashimoto's. So these triggers can be various different things. Can be toxins, can be infections, can be food sensitivities, can be stress. Can be all different kinds of stresses that we go through. So these five categories can trigger Hashimoto's, and which can be we can be exposed to all different pathways, like as you express from the gut. So leaky gut, is an important concept that we now know that research proves can lead to autoimmune conditions. So just imagine that, eating a bad food, like a processed food, or a food which your body is sensitive to, if you consume that, then it destroys your gut. And that signal from the gut reaches your body, and that body is prompted to produce antibodies. And that ultimately leads to destruction of this thyroid gland. So as you said, nobody can even think about, okay, is there a connection between gut destruction or your food and your thyroid gland? How are this all connected? So that's the good part about the modern research, is that we are trying to put all of these pieces together and understand this complex phenomenon of thyroid destruction by all different pathways that we are learning about now.
Mm-hmm. Yeah, because I know, we look at T3, then T4, and then think, okay, but we're always looking at the result in a sense, as if, like you said in the beginning, as if the only way to modulate it is with iodine, whether it's natural or not, but there's more to it. That's basically what you're saying. And knowing that it is an autoimmune disease, we have to look at why that's triggered, which then brings all the possibilities, stress and food and environment and all of that. So how do you then approach people now when they come in? Because the thing is, if the gut is off, maybe your only symptom is not having enough energy. Right. And so you go, where do you go for not enough energy?
Exactly. And that's, like, unfortunately, the symptoms of Hashimoto's or thyroid are so common and, like, so interrelated with other diseases that unless we do the right testing, we will often miss that. So
Mhm.
the most common symptoms, as people know, as you mentioned, low energy or feeling tired, brain foggy, weight issues, mood changes, feeling depressed, anxious, infertility, gut problems, IBS. All of these are a big collection of symptoms, which can be present or can be determining that, you have a thyroid issues going on. Now, the first thing that I always recommend everybody to do is that make sure that you are getting a complete thyroid test, because most of the conventional doctors will only order a TSH, which will absolutely miss,
Right.
like the diagnosis of Hashimoto's or other thyroid disorders. So make sure we are checking a TSH, then we are checking the free T3 and the free T4. That gives us a good functioning about the thyroid, but it doesn't again give us information about Hashimoto's. So for Hashimoto's, it is very important to get the antibody levels checked. So the two antibodies are the TPO, which is a thyroid peroxidase antibody, and the second one is a thyroglobulin antibody. So these are the antibody levels which needs to be checked to know whether you have Hashimoto's or not. So
Mhm.
this is the basic thyroid testing that everybody should get. The good part is that each and every lab is capable enough of doing these testing. And the regular doctors can easily order it. You just need to ask them to do these testing and they will do it for you. So by this testing, we will know where you are dealing with and what's going on with your body. And then once we know what we're dealing with. Now, the other problem which happens sometimes is that, the symptoms precede the lab changes very
Right.
often.
Mhm.
So
Mhm.
you, a lot of females come to me, see me that, I had symptoms for like several years before the lab actually caught up with me.
Yeah.
So I said, that is exactly the time that we should be actually working on you so that, it's easy to reverse those symptoms at the time, while waiting for like, your body to crumble up.
Yeah, I've made a joke in my practice. I just treat people that are lab negative. They're full of symptoms, but the body hasn't gotten to the point of not no return, but once it really goes into the body, whether it's kidney issues, you have really loss of function in many cases, right? It's too late, not too late. Like, I don't want to say that because it can be done, but you really want to pay attention to your symptoms. And I don't know how many people I've seen where they say, well, or they've been told, well, it's all in your head, clearly, at this point, you know?
Exactly. I was that same person, like,
Mhm.
obviously being a physician, nobody kind of said it straight, on my face, but behind the back, like everybody was saying, it's like, it's all in your head. So I
Right.
could actually relate to my thyroid patients then and there that, like how they have been ridiculed,
Yeah.
for years, like by their physicians that, oh, this is like mom brains you are going through. Oh, this is all in your head, just
Yeah.
take a break, you just need to take a vacation. And they
Right.
are keep on telling me that no, 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 something is wrong with me, can you please help me? And
Yeah.
unfortunately, like nobody listens to them, and they kind of think that they're doing the right thing by approaching all different physicians, but unfortunately their training, like as have been trained conventionally too, their training tells them, okay, well, just check the lab. If the lab is normal, that means a person is normal.
Mm.
And now we know that the lab has limitations to it. I always tell my clients or my patients is that I'm not treating a lab, I'm treating a person. So I'm going to listen to
Exactly.
you. I'm not going to listen to a lab.
Hi, I'm Dr. Manon Bolliger, and I wanted to take a moment to thank you for watching these podcasts. If you haven't subscribed, please do. Also, feel free to leave comments and like it. This way, more people get to find out about this work and about other choices for health. So I think it's really important that we all share this information. I have a free gift to you. It's a 7-sequence email that has tips for every day, and it's a little insight about how to live your life when it comes to health. And it's very much built on how I managed to overcome stage 4 cancer and what it took. So I would love you to have this, and thank you once again for listening to these podcasts. Yeah, no, very good point. So what about this peptide therapy? How, how does that work? How did you come to realize that it's so helpful?
Yeah, so peptide therapy actually is like a revolutionary thing which has been introduced, to us in the last few years. Well, we have used peptides for several ages. Insulin is a peptide, and
Mhm.
now that was the first external peptide that we were able to develop and has been using. The other problems with the other peptide was that we were not able to harvest them, from our human body to be utilized as in the form of medicines. But with modern technology, now we can combine them, with certain chemicals to make them more stable, and we can use them as part of medicines. So that has kind of prompted us to use these peptides in different diseases, and thyroid is one of those. So peptides are natural compounds which are made by our own body. So peptides are a collection of amino acids, like how proteins are a collection of amino acids. Same way, peptides are also a collection of very small number of amino acids which are produced by our body. Now we have been researching different kinds of peptides for a long time to see how we can use them, for different diseases. So in thyroid, as I was looking, there have been several supplements, dietary changes, and everything that a lot of people do. But still, there are some people who do not get better. So
Mhm.
I was looking for other avenues to kind of give a complete package to kind of my thyroid patients to do each and everything I can do to get them better. So that's where I came across certain peptides, which have shown to be, like beneficial for thyroid patients. So certain peptides, which I use in my practice, which can be useful, is one is called thymosin alpha 1. So thymosin alpha 1 is basically a peptide which is produced by our thymus gland, which is an important regulator of our immunity as well as of our immune function. So as I explained to you, majority of the thyroid patients now these days have Hashimoto's or autoimmune conditions. So what
Mhm.
happens is that their immune function is basically trying to destroy their own thyroid gland, right? So this thymosin alpha 1 actually retrains the immune system and tells them it's okay, don't destroy the thyroid gland, it is your friend, not your enemy.
Mhm.
So that's one retraining that it does. then a lot of times what happens in the thyroid patients that there is too much inflammation going on in their body.
Mhm.
And there's a vicious cycle of inflammation which keeps on ongoing and ongoing. It only not only destroys the thyroid gland, it also destroys the mitochondria, the gut, the
Right.
adrenals, the brain, all of those things. So this thymosin alpha 1 again is a very potent anti-inflammatory peptide. Reduces inflammation and safeguards all the different organs which are destroyed in the thyroid gland. So this is a very good peptide that helps a lot of folks, with thyroid disorders, especially this thymosin alpha 1. The
Mm.
second peptide, which is very useful, is the BPC 157. Now, this peptide again is naturally produced by our gut. It kind of layers the gut and helps them to protect, from all the external things that our that our gut get exposed to, whether that is viruses, pathogens, infections, or bad food. Now, this BPC actually has a very nice property of healing leaky gut. So again, as you were talking, initially that leaky gut actually can be that initial insult that happens in the gut, which leads to this thyroid dysfunction. So by healing the leaky gut, this BPC is very, very useful. Now, most of the people with thyroid disorders do have gut dysfunction, whether
Mm.
that is constipation or diarrhea or bloating or IBS, all of those things. So BPC again helps, like to improve the gut immunity as well as helps with improving the gut dysfunction. Other thing BPC is very helpful is for acid reflux. So again, BPC, because of the function in the stomach, it basically protects the stomach lining. So a lot of people who are suffering from acid reflux, this is an alternative to
Mhm.
using the regular PPI medication, which does have a lot of side effects.
Right.
And the BPC, the other actually benefit is healing. So it helps the body to heal, whether that is tissue injury, ligament injury, muscle injury, or even like, joint pains and muscle pains. It again, a lot of thyroid patients go through that. So this BPC could be useful for that.
Mm.
So these are the two peptides which have, find phenomenal results with, like my thyroid patients. These are foundational that, they can get started on this. Now, there are certain other peptides based on what we find is wrong with the thyroid patients. Like there is again thymosin beta, which again can be used if people is a lot of inflammation. There are certain other peptides which could be important, for mold toxins or for fighting the Lyme infections.
Mhm.
So those can be an additional thing on top of these things. But I think these two are foundational peptides. The good part about these two peptides is that there is no side effects. Like,
Mm.
they are naturally produced by our body, very well tolerated, no issues. Like we have good amount of literature now that they are really safe for majority of the patients. So I think, like as we come across more and more peptides, as the new research is coming up,
Mhm.
like new protocols will be developed, and this will be a very new way and one more additional way of treating thyroid patients.
Mm. Yeah, no, fascinating. Yeah, I have not been active in my practice for lots of reasons in the last, I guess a year now. But so I have not been up to date with this. So that's fascinating. And it makes me think of all these other possibilities that it could be used for as well. But one thing that I'm personally curious about is I've seen many patients that are diagnosed with a thyroid issue, and they usually say it's hyper or hypo. And when you actually treat their adrenals, it, they no longer have the thyroid issue. Have you had this experience, or can you yeah, is that something that you have seen, and if so, what is your reason that you see this? Or I mean, what are you saying about that? It's not
No,
very good English.
absolutely. Right. A very important question. And again, like, so for me, like whenever somebody comes to me, say that I have a thyroid disorder or like my blood work is showing this situation, I said, this is just one red flag that your body is showing to you. Like if you drive a car and the check engine light is on, you don't kind of, ignore or put a sticker on the check engine light and you keep driving the car, because your car is ultimately going to stop. So that's the reason, like whenever somebody thyroid is not functioning, there has to be other reasons, other things which are causing the thyroid to not function properly. And there is a strong connection between the adrenal glands and the thyroid. So this is very important that happens. So adrenal glands, secretes this cortisol hormone. The cortisol hormone, whether it is very high or very low, regulates the thyroid gland. So when the cortisol levels are too high, it kind of shuts off or sends the signals to, again, stop producing the thyroid hormone. That's one thing. The
Mhm.
second thing is that the thyroid hormone, which is produced with the thyroid gland, is made in the form of T4, which is what we call as an inactive thyroid hormone. It needs to be converted to the active thyroid hormone, which is the T3. Again, the cortisol interferes, with the conversion of T4 to T3. So that's another problem that it causes. The third thing which cortisol does is that there is something called reverse T3.
Mhm.
T3 hormone is basically the gas pedal which lets your thyroid function. Reverse T3 is the opposite, which is the brake pedal, doesn't let your thyroid function. So whenever the cortisol levels are high in our body, it actually promotes more reverse T3 production. So
Mhm.
again, it does the opposite. So all of these things or all of these reasons, are what causes actually, like if you have an adrenal dysfunction to lead to actually causing a thyroid dysfunction. So let me kind of share the story of my client. She came to see me, 35-year-old female, a woman, with having one kid. First pregnancy was 2 years ago. After the pregnancy, she was diagnosed with, postpartum with a thyroid disorder. She was obviously feeling tired or fatigued, not feeling great, was put on the thyroid medicine, no changes. She was still feeling the same. So she came to see me at the time and I said, okay, well, Dr. Gupta, I'm feeling so tired. I don't know what to do. I'm taking the right medicine. They told me that my lab work looks great, but I feel miserable. I don't have energy to take care of my kid. I just feel that I'm a horrible mom.
Mhm.
And I was like, no, you are not a horrible mom. It's not your fault. If your body is not functioning, we need to figure out why is that not functioning. And then that's where in the very first visit we started kind of peeling the layers of her history of what was going on in her life. So what we figured out was that since at a very young age, she was exposed to chronic amount of stress during teenage years. She went through, like, okay, she was like, I want to accomplish everything in my life, then work stress, and the final blow to her body or the stress was actually the pregnancy. So
Mhm.
a lot of people, a lot of females do not know that pregnancy can actually be a very stressful situation because it is very physically demanding to their body.
Mhm.
It does, kind of put pressure on what nutritional, things that, body needs and other things too. And we commonly see that postpartumly, because of all that stress, their adrenals gives up, and that actually leads to thyroid dysfunction. So that was the situation with her. So then we started working on adrenal glands by putting her on stress management techniques, by putting her on some supplements to support her adrenal glands, and boom, within 4 months, her thyroid was so much better. She did not feel the need of the thyroid medicine. Slowly, we were able to get her off the thyroid medicines, and she was like, I had no idea that,
Mhm.
I thought that it was my problem was my thyroid gland, but actually her problem was the adrenal glands, which were causing that issue.
Right. Yeah, what you're bringing up reminds me in my work, I do a lot of trauma care, and trauma and stress, it's like a chronic level of stress. And people say, oh, it's just in your mind, just change your circumstances. What people don't realize is it actually impacts the physiology of your body. And then we start seeing problems, and it could have been from a long time ago, but it's the fact that it's also perpetual. That, and people don't realize that. They think, oh, I can deal with this, it's fine, I'm strong enough, and slowly it's impacting them in a very profound negative way, for sure.
Exactly. Now, we have this research studies, right? The adverse childhood events, people who have been exposed to trauma as a child, turn 20 years, 30 years down the lane, they have more chances of having actual physical medical diagnosis of heart disease, like autoimmune diseases, cancers, all of that stuff,
Yeah.
just being exposed to trauma 20 years ago, right? So there is no refuting that, once you get exposed to trauma, it can live in your body for a long time.
Mhm.
So it's not just about being tough. I think it's not a
Yeah.
mental issue. It's
Yeah.
more about like, your body reacting to trauma in a negative fashion. So unless we address that, our body is not going to get better. So
Mhm.
definitely, like, I feel that, people like you who have been working with, people who have been inflicted with trauma, that is very important work, and everybody should consider doing that. Because it's just not about being weak. It's about actually using these techniques to actually fight off, certain things, which circumstances lead us to kind of get exposed to.
Yeah, and it's really ultimately the integrative approach. It really is the whole person, and whatever happens in a person's life has an impact. And some of it you can, with your mind and your heart, see it differently, do that type of work. But we also must realize that our body is a reservoir for the impact of this, and so many of these symptoms that don't make direct sense, in the sense of, it could be just bad sleep, it could be weight gain for no reason, like all the ones you've mentioned, can lead to conditions that are harder to diagnose as just the diagnostics of it. It may not, you have to look at what else is going on and treat the whole person, so anyway, we're almost at our time up. It's been so interesting. Is there anything else that you would like to add? And also, where do we get your book? I'll put the
Yeah, so
link after our talk for sure.
yeah, great. So the book is available on Amazon. So, like people can order it directly from Amazon from wherever they are in the world. They can order it. They know it will be delivered to them. They can find me on a website. So I do have a website called anshulguptamd.com. That has tons of information about folks, research-based blogs where they can learn about their condition, how to get it better. Right now we're running a promotion where, if you're interested in working with us, we are offering them free evaluation calls with me, so that they know that, how to work with me and how working with me can actually improve the situation. So again, they can go on a website called anshulguptamd.com, and there is a link over there to click to get a free evaluation call. So they can certainly avail that.
Great.
But in the end, I want to tell each and every patient or every person who is suffering from Hashimoto's or thyroid disorders is that do not lose hope. Okay. Your life should not be limited by Hashimoto's. You deserve a life which is filled with hope, happiness, mental clarity, and lots of energy. So don't let anybody tell you that there is no hope for you. There is ample hope. You just need to do the right things and you will get better.
Well, I'm going to leave it on those words. Thank you so much for being part of this conversation.
Thank you so much for having me over here. My pleasure.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.